Hello, my name is Eileen. I'm a nurse with Colorplast and I'm over in the west of Ireland. I'm going to talk to you today just an overview on the digestive tract and bowel elimination and in the use of Peristine transanal irrigation. So just an overview of the bowel first, or the digestive tract, or the gut, or the GI tract. It's called any of those things. It's one passage from our mouth down to our anus. It's that mucous membrane the whole way down that starts in our mouth and then travels the whole way down, doing different things obviously on the way through. And we ingest, we digest, we absorb, and we eliminate via the bowel or the gut, the GI tract. So the gut responds to many things really, but it very much responds to the messaging that we get from, if you can imagine, when you walk down the town, you pass by a bakery shop and you smell the bread. That gives you that sense of hunger. That has just stimulated your GI tract. When we eat some food, that stimulates the gastric juices in our mouth and in our stomach to then go on and get into action and start waiting to receive food and to start digesting it. So it's a complex system of responding to stimulus and absorbing, digesting the food as it goes down and absorbing it. So the stomach, obviously lots of gastric juices happen in there, and there are other organs involved as well here. We've got the gallbladder, we've got the liver, all adding into the gastric juices and the mechanisms of our digestion. All the absorption happens, lots and lots of absorption happens in the small bowel. So by the time, and we're really talking about the large bowel, so by the time things get to your large bowel, which is here, I don't know if you can see my little laser. So things come into the large bowel, and this is where things very much slow down, and things can be quite watery by the time they come here, and then water gets reabsorbed and things slowly get moved along then through this large bowel and down along the bowel. And we have this muscle contraction called peristalsis that happens. Now we have, that's happening at a low grade kind of a lot of the time, but we have maybe one, maybe two, maybe three episodes of kind of mass movement in a day. So that's where we get a big wave of peristalsis, and it helps to push this fecal matter along through the large bowel and move it on down to the rectum. When the messaging system is interrupted and things like that, this push or the stimulus, the messages might not get through to the large bowel to do that pushing along, and also the longer any stool stays in this large bowel here, the more water gets absorbed out of it, and the harder it gets, to move. So there's a tricky situation there where the push might not be so strong or so often, and also then the stool in the large bowel gets really, really hard to push along. So normally then when stool has been pushed along, we'd like to keep it nice and soft, and then it keeps coming on down through the large bowel and into the rectum. And the rectum is the kind of brainy part of the bowel. That's the real part that senses what's going on, because the stool can be pushed along down into the rectum, and the rectum stretches up, and that's what gives us a sensation. You know, our brain recognizes, the rectum fills, and our brain recognizes that we need to go to the toilet, and we look for a place to go that's convenient and safe and good for us, and then we go and our bowel can evacuate properly. That's normally the way things happen. So it relies on a lot of things. The whole GI tract from top to bottom relies on a lot of things, but the bottom part of the bowels does rely on a good few factors. And this stretching up of the rectum is very important to give that would stimulate one of those mass movements then that I was talking about, to push the stool along to come out and to be able to defecate. There's a complex number of things going on here as well with the internal and external sphincters, so they need to be able to open and stay closed under command as well, which involves our messaging system which can be complicated in a spinal cord injury and interrupted. So that's just a view of the digestive tract. When we talk about a neurogenic bowel, then, so that's a bowel that's affected by a neurogenic disorder, and a spinal cord injury is certainly a neurogenic disorder. So it can be described as slow movement of stools, constipation, bowel leakage, and difficulty emptying the bowel. Control of the external anal sphincter muscles may also be disrupted, increasing the risk of bowel accidents. Bowel problems. If you do have a neurogenic disorder, you may have the neurogenic bowel, and it's likely that the nerves in your spinal cord controlling the bowel function are damaged. Some neurogenic conditions causing bowel problems include spinal cord injury, of course, multiple sclerosis, spina bifida, Parkinson's disease, and there are many more as well. Stroke might be one, multiple systems atrophy, spinal cord compression, those kind of things. So there are many problems that can cause the neurogenic bowel. There are many other reasons as well that people have bowel problems. Studies indicate that up to 20% of our population have problems with constipation. And this can result from slow transit constipation, or a person can just be, that transit time we talk about is the time that matter takes from when we ingest it to when we eliminate it. So that time can just be very, very long in some people, which causes constipation. There can be anorectal malformations from birth. We have inflammatory bowel disorders, obstetric trauma, so trauma to the pelvic region after childbirth and to the sphincters can cause bowel problems, and cancer to the colon and rectum as well. And it's probably not so much the cancer itself that's causing the problems, but maybe the treatment, so the surgery and the radiation that a person may have had to go through, that can leave a person with bowel problems. So bowel problems are they're out there a lot for a lot of the population. Bowel symptoms then that can happen, bowel leakage, so involuntary passage of stool, so that when we can't control when the bowel opens, resulting in the bowel accidents, and that might be due to that sphincter not being fully under our control due to our injury. So that, you know, as I say, the internal sphincter, when the rectum is full, the internal sphincter can open, but then we are continent because we can get to a toilet and sit down, and then under voluntary command the external sphincter will open. So that control can be interfered with in a spinal cord injury, where you can have bowel accidents. There's also with bowel leakage as well, it's the inability to differentiate between wind and stool as well, so that can happen there as well. Constipation, and there is no exact science for what constitutes constipation. Symptoms can vary from person to person. Some people going about can move their bowels 2 or 3 times a week, where another person might need to move their bowels twice a day. As I say, there's no exact definition on that, but it's often characterized by the decreased movement of bowels and straining and difficulty in defecation. We talked about just there in the previous image of the large colon and the bowel going around, where the stool can get very hard going through and difficult to pass. So that's really important to try and keep that stool as soft as we can. I also talked about the mass movements that we have in the day as well. So we have maybe they can be maybe twice a day. The first one maybe being after our breakfast in the morning, where you've had your breakfast and your coffee in the morning, and then 10 minutes later your stool has moved along and into your rectum has stretched up, and you get that signal to go. So that's one of the mass movements that is there. And it's really important to, if you're getting those mass movements, to respond to those mass movements. And as I often say to people, and you know, educating kids on bowel movements and things like that. I mean, it's and we all live busy lives, and sometimes, you know, we're rushing around in the morning, getting out in the morning and having breakfast, and having the last mouthful of coffee and toast and running out the door, and then 10 minutes later you're in traffic, and then your bowel that motion has happened and you're getting that signal that you need to go to the toilet, but there's nothing you can do about it, so you have to let it pass and let it go and hold on to that stool. So, and that's really not good for our bowel movements as well. We really need to give ourselves the time and the regularity to go to the bathrooms, or to give ourselves the opportunity to go to that toilet and to respond to that mass movement and that stimulation from the rectum that we're getting. And also as well, just to go talk about children going to school as well, it's really important to give them that time in the morning at home, to come and have their breakfast, have some more time in the home upstairs to be able to go and respond to that need to go to the toilet before they get to school, because kids will not go to the toilet at school probably. They've more important things to do at break time and playtime, and that's the playground. So it's important to set the scene and allow the bowels some time to go. Overflow incontinence. This is a combination of bowel leakage and constipation, and the reason for the overflow incontinence is the constipation. So I talked about that the hard stool being kind of impacted or slow to move along in the large bowel again, and that's where the stool coming along behind, wanting to pass through, can't, because the hard stool is there. So it will it'll overpass the hard stool and come out as liquidy stool. So that's what we call overflow incontinence. But the reason for that overflow incontinence is a hard stool, and it's kind of constipation. Treatments for bowel issues and bowel problems can include diet and fluids. So diet is very, very important, that we eat good high fiber diet. And I'm not going to talk about diet today, but we all know what a good diet is, really. To make sure our stool stay soft. There are good fibrous diets that we can use. Plenty of fluids. Again, it's that dry stool that we need to soften up to be able to pass along. So plenty of water. And I know that might be an issue with managing bladders as well, but for our bladder as well, we need to drink plenty of fluids. So fluids are very, very important. And around that diet as well, I keep going back to the diet and lifestyle as well, and it's that lifestyle as well to set aside time for your bowels to move. Give them some time. Like that scene in the morning, don't be stuck in traffic, 15 minutes away from the house, and you get that call to go to the toilet. That's not going to do you any good, because you might not get that good a call again later, and then you're a day behind in moving your bowels. So it's very important to be able to respond to that stimulation that we do get to move our bowels. After the fluids then and the diet and lifestyle, we come to medications and laxatives. So stool softeners. There are many different types of laxatives out there. There are stool softeners like our lactulose and our Movicol, Maxolol, and then there are stool stimulants like Senna and Dulcolax and things like that. I'm not going to go too much into them, but these can help with moving our bowels. And then it is that in combination with our diet and fluids and our lifestyle. So again, to take them at the right time for you. If you want your bowels to move in the morning, then maybe the night before is the time to take the laxatives. So that needs to be all figured out, and that's down to a person by person routine. Skin care is very important. If you're having poor, if bowels are moving a lot, or if we're having some overflow incontinence or some incontinence, our skin can get quite eroded and painful and sore. So skin care is very important to cleanliness and hygiene, and a good barrier. Bowel training. So again, just getting your bowel into a good routine and time. Manual help and stimulation and suppositories. So some people might need to use digital stimulation and or evacuation, and the use of suppositories as well, so just the glycerin suppositories. And I'm going to talk about transanal irrigation as well. That's another system. So I'm going to talk about the Peristine transanal irrigation, and then another treatment could be stoma surgery. So that is for that takes surgery, and maybe some of you have stomas out there, but that means diverting your bowel or your bladder out to the abdominal surface, and your bowel would empty out onto the abdomen and into a bag on your abdomen. So irrigation has been used for, it's dated going back to way prior BC. It's been a means of managing bowels. So managing bowels is obviously not a new thing for the human race at all. It's obviously, you know, it's the first thing we do when we're born is our bowels need to be able to work, and if it comes along, bumps along the road in our lifetime, it constantly needs to be managed. So irrigation has been used for a long time. It's the process of facilitating evacuation of feces from the bowel by passing water into the bowel via the anus in a quantity sufficient to reach beyond the rectum. Now, at this point, I would have liked to have put in a 5-minute video of Peristine and how it works, but I'm going to ask Naomi to play that video for you after my presentation, because technicalities prevent me from putting in the video into this presentation and the recording, so apologies for that, but I'm going to ask Naomi to play it for you after my presentation. And the video will go through how Peristine works. Some of you may be using Peristine already. It's always good to just have a little refresher on Peristine maybe, and just to make sure that things are going right with it. But it is the use of water, using the rectal catheter to pass it up through the rectum to facilitate the bowel movement, and you'll see that in the video. Peristine has been proven to give people a greater quality of life. Management of bowels can be such a toll on a person's life. It can be so consuming, I suppose, if they're not right. You know, it can take up a lot of time in the day, either at the time of bowel evacuation, or else it can go on through the day. A person might need to revisit the bathroom, you know, 3 and 4 times during the day at attempts at evacuating their bowels, and it's just not happening. So the Peristine if suitable for you, it can help in that way and facilitate evacuation at a time when is suitable for you and on demand for you at home in the bathroom. And I'll let that video go on. The Peristine has been with us since 2015 in Ireland, and it's been available on our medical card scheme here since then. So hopefully you'll enjoy that video. I'm just going to go through, these are some X-ray visions of bowels. This is the large colon here. So this is in a normal person that has not got a spinal cord injury. That's before defecation there, so you can see where this is the part that we're looking at here from the left side down, and then after normal defecation, you can see that the left side should be fairly empty. We're going on then to, this is a spinal cord injured patient where you can see there's probably a bit more here than there should be, but the left side is full and the rectum is full as well. And then we go on and you can see that the after defecation here, that the rectum has emptied all right, but really this left side of the colon is still full, and this is what can give you that incomplete emptying, because all it takes is a small one of those little peristaltic motions or some movement of the bowel down, and the rectum can be filling again, and that will give you that feeling of incomplete emptying, and that need to go back to the toilet again and again. And this is post irrigation. Then these pictures are here. So this is prior to defecation, so that you can see that the rectum is full and the left side is full, and then after the transanal irrigation, this whole left side is empty. And this is what we really want, because we want that clear way, and that gives the person, you know, up to 48 hours that you don't have to move your bowels, or it doesn't come into the rectum, and therefore it's not coming into your brain, and you can just, you know, you have your bowels open and then forget about it for 2 days. Hopefully that's the optimum outcome that we would like from transanal irrigation, that you can have a controlled bowel management regime for yourself. Sorry, just going back to that. It's not going back for me. You will have seen that. Hopefully, you'll have seen if you are using Peristine, that in the kits that you've been having over the last couple of months, there'll have been a leaflet or some literature in there telling you that Peristine has been new. There's an improved version coming, and it's online now. It's been on the PCRS now since the 1st of October, and it should be starting to come through the pharmacies now, and it's called Peristem Plus. The main features of the Peristine Plus, and I'm going to give you something to look at after this presentation. It's the main features, the upgraded features are the connections between the catheter and the tubing, which, if anybody of you have been using Peristine, if they have always been fairly tricky to put together. So that's the main feature. One of the main features that's new and improved on the Peristem Plus is the connection between the tubing and the catheters. The dial, or the knob on the dial, is easier to handle as well, and the symbols are slightly different. The actions are still in the same positions on the dial, but just have a look at the symbols, and they're slightly different, and the knob is easier to handle as well. So it's the same principles. It's got the same guidelines. You're using the same amount of water. Everything is the same about it, but just that the catheters are easier to put on. And with that, I can just tell you that the old catheters are not compatible with the new kit. So that if you're getting a new kit, the Peristem Plus kit, you must have the new Peristem Plus catheters as well. So just to watch out for that, and please give me a call. I think I'll be talking to you today as well once this presentation is over sometime during the day. You can ask me, or you can contact myself or Kira about this as well if you're having any trouble with the changeover. And there's going to be a little video as well to follow, that you'll see the new Peristem Plus. So, Colorplast.ie have a website. It's really, really informative. There's lots of stuff in there about bladder and bowel. There's videos on there. There are videos for adults, videos for children, for carers. There's lots of resources in there, people's stories, there's diet and lifestyle and travel, lots and lots of information on there. So do hop on to colorplast.ie there, and you can navigate your way around there. It's a nicely easy website to use as well. Just tap on the bladder and bowel tab, and it'll take you through. It's very easy to navigate, is the word, or work your way through the website. It's I find it quite easy to use, and there's lots of things in there. There's also a Colorplast Care tab in there as well, that you can register for Colorplast Care, and then you'll be on our system, and you'll get updates of product updates and upcoming events, and we have some webinars coming up and things like that. So do register onto the Care program and have a look at the website.